Hi everyone, I am Pooja Shah, the operations editor at Insights Care. So today we are talking about something that affects many women, whether they talk about it openly or deal with it quietly. In our lives, we have all known someone, a friend, a mother, or maybe even ourselves, facing health challenges that can feel overwhelming. The fear of surgery, hoping for easier solutions, and trying to balance with everything else. This is what we go through every day. But in times like these, new ideas in healthcare really make a difference, not just to treat us, but to care for us. That's why today's conversation, 360-degree care from vNOTES surgery to lifestyle transformation, is about changing how women experience treatment and healing. Instead of focusing on the fear and anxiety that often come with health issues, we will talk about real solutions like VNOTES, a gentler, minimally invasive surgical option. And just as importantly, we will also look at the small, everyday lifestyle choices that can help women protect their health and possibly prevent bigger issues down the line. So, joining me today is Dr. Vindhya Gemaraju, a well-known gynecologist at SO Polyclinic and one of the top 5 women leaders empowering the future health care in 2025. She's helping women not just with surgery, but with a full approach to health. So, Dr. Vindhya, I'm truly honored to have you with me today and to dive into these important conversations together. So
Thank you for
let's
your introduction, Pooja.
Yes. Let's start, doctor. So let's start with some simple topics. When I hear the word surgery, and
Mhm.
immediately I think of pain, scars, and long recovery. But we knows, as far as I've read, it's changing that story, right? So what
Yes.
exactly is it, and how does it work?
See, we know as per se, we call it as a vaginal natural orifice transluminal endoscopic surgery. It itself means that we enter through the natural orifice. So we all know that we have natural orifice like mouth, two nostrils, vagina, and anus, right? So these external opening are getting connected into your body. Like we can enter through mouth into the stomach, right? So like that, every part of the external orifice is connected into your tummy. So in gynecology, the most important external orifice is the vagina. So whenever the woman faces an issues with uterus, tubes, ovaries, we can enter through the natural orifice. So when we are entering through the natural orifice, there will be no visible cut outside and there will be no scar visible outside. So this is a newer trend which is changing, especially in the gynecological surgeries.
Okay. But we have also heard a lot about laparoscopy. But we notes when it comes to this, it sounds like something different. So, can you explain how is it different from the surgeries that women used to have traditionally?
Yeah. So as per se, so when we go into backs of 1980s and all those things, we used to have open surgeries where we used to give a cut on your tummy, at least 6 to 7 centimeters or 8 to 10 centimeters cut on the tummy to enter into the abdomen, means that is your
Right.
tummy. So
Yes.
to enter into that and to reach your uterus, tubes and ovaries. So as the science get advanced and the surgeons always prioritize the patient safety and patient's painless and all those things, so they always try to invent newer things. In the newer inventions, we try to do the minimal invasive surgery, which is known as the laparoscopy. In laparoscopy, we don't give the cut on your tummy like traditional open methods. We
Okay.
just give a at least 1 to 2 centimeters cut on your tummy around your umbilicus, that is navel area, and 2 to 3 incisions. We call it as incisions around your tummy, but it is around zero point 0.5 to 1 centimeter. So now the cut, which has been 8 to 10 centimeters, has reduced to 2 to 3 centimeters, right? So, and the pain is very less, and this will provide you easy recovery and fast recovery. So when you compare this to the newer innovation known as the VNORS, as I told you earlier, that VNORS we enter through the natural orifice. So we don't cut anything on your tummy, right? As I told you in your laparoscopy, we give a 1 to 2 centimeters cut near your navel area, right? Now we are
Right.
not going to give any cut on that navel area, and surrounding three incisions also we are not going to give anything. So your tummy will be very clean as it was there prior to the surgery. So we enter through the vagina. So vagina is getting connected to your tummy at one point. Through that point, we enter into the tummy and we reach the uterus, ovaries, and tubes, and we perform it. So, as I told you, in the technique and in the benefits and advantages wise, there is a lot of difference between the traditional laparoscopy and vNOTES. So, as I told you, in technicality, there will be no scars and no incisions will be given on your tummy. In vNOTES, we don't give any scars, but in traditional laparoscopy, we give incisions like 2 to 3 incisions depending upon the type of surgery we are doing it, and sometimes even we give you 4 incision when the uterus is very big. So this makes the difference between the traditional laparoscopy and vNOTES. We don't give any incisions or scars on the tummy.
Okay, so when you say let's get real for a thing, like patients care about the basics first. So
Mm.
less pain. You mean vNOTES is actually delivering this like less pain, faster healing, no scars? Is it really possible?
Yeah, as I told you, there is advantages of the venous over the traditional laparoscopy, right? So we are not entering the tummy by giving incisions, right? We are
Right.
entering through natural orifice. So there is no incision or no scar. When there is no incision or no scar, there is no pain at all.
Pain.
So when we are entering through natural orifice, that area is generally less sensitive to the pain or sometimes insensitive to the pain. So when I enter through that area, you won't get any pain sensation, but you feel
Mhm.
like something because we have removed some organ or we have done some surgery. You feel mild discomfort, but there is no pain. As we are not entering through the tummy, you will not be seeing any scars because some people have a tendency of forming a scars that you heard about. The scar is increased like keloid scars, that the scar will be very increased
Yes.
in size. Sometimes the scar will look very abnormal, ugly, and all those things will be there, right? In venous, the advantages of venous, which is very important, is no scars on the tummy and less painful. And because you don't feel any pain at all, you get up immediately and your recovery will be very quick. In
Okay.
laparoscopy also, when you compare to traditional open procedures, laparoscopy also will provide you quick recovery. But when you come to the venous procedure, the recovery will be much faster. For example, if I operate a case of venous today morning, I will discharge her by tomorrow morning itself, and she'll be getting up within 4 to 6 hours, and she starts her ambulating. Means we'll allow her to walk, to roam around, so that she can feel free. So this is more advantageous than the traditional laparoscopy. And some patients will have a hernia, where you heard about the hernia, that there will be a defect in the abdominal wall where the abdominal contents come and sit over there. In
Mhm.
those cases, when we give cut on your tummy, the chance of you developing hernia will be more. So when
Yeah.
I'm entering into the lab, we notes, we don't cut anything, right? So we just enter through the natural orifice. So the chance of hernia also very, very less. And whenever you operate for gynecological conditions, some patients are very obese. In those cases, we have to give much size of the incision. Sometimes 2 centimeters may not be suffice. We need to increase to 2.53. But when I do through venous, there is no incision at all. So this is much advantageous and much more beneficial to the patients compared to the traditional laparoscopy.
Okay, that was a brief explanation. Thank you, Dr. Vindhya, for that. But I have a question. Like, in what situations do you recommend B notes? Is it just for specific conditions, or is it becoming the new normal these days?
See, actually, you can say that any gynecological procedure like removal of the uterus, removal of the tubes, removal of the ovarian cyst, removal of the tubes, and sometimes ectopic pregnancies also. Sometimes we need to remove the tube and ovaries. All the surgeries which is related to gynecology means wherever you have a problem with your reproductive system, especially females. So in those cases, we can use this venous procedures. See, anytime whenever we start a newer procedures, there will be some challenging. So you need to train yourself. Once you get trained in that venous, any type of surgery you can do through venous. Recently, we started doing the cancer surgeries also through venous. Previously, we used to do only non-cancerous surgeries. Now we started doing the cancer surgeries also through venous. So what all the problems women have, especially related to their reproductive things like uterus has
Mhm.
any fibroids, or sometimes they have a heavy menstrual bleed where it is not getting controlled with the medications, and you have tried all sorts of the natural techniques there where there is chance of you not recovering back with the medications, they opt for the surgical things. In
Mhm.
all those cases, vNOTES can be done.
Okay. And who should consider vNOTES? And I'm sure there must be people wherein you will say that this is not the right option for you. So, are there any cases where who should not consider and who should consider?
Whenever we started the initial days of vNOTES,
Mhm.
we had some restrictions, like whenever we are not able to enter through the natural orifice into the abdomen, because the instrumentations, because it's a newer developing thing, right? So we have to advance our instrumentations, we have to improvise our instrumentations. In those
Mhm.
cases, we had faced a problem where there's a obliteration of the post. The entrance part was too much obliterated. It is too tight in those cases. Were not doing it.
Mhm.
But right now, with the improvement of our instrumentation, we started doing in those cases also. So, as per se, there is no specifically contraindication that we cannot do this procedure to this person is not there. The only
Okay.
thing is we can try for every person because every woman has a chance, right? That she can undergo venous. So for every woman, we try the venous. If we find there is any difficulty, then very less chance of you converting into the laparoscopy.
So, for most of the people, this is the right option. We cannot say
Yes.
this is not the right
Mm.
option. Great.
Yes.
So, moving ahead, I guess every surgery has this, what a fear in
Mm.
the people's mind being a, okay,
Yes.
but for suppose if I'm a patient, I will always have this fear. What if this does not work? So, what are the realistic risks or limitations with V notes?
Yeah, as I told you in the before only, that previously we had certain limitations, like there
Mm-hmm.
is the entrance area is been closed or it is
Correct.
obliterated, right? Right now we have improvised our instrumentation so we can overcome this. So as per se limitations right now is the advanced cancers. So whenever there is an advanced cancer, we are not performing the VNOS. But all the benign gynecological conditions where you require the surgery, this is the best option because this will have the advantage of you recovering very quickly. So we always prefer doing this. Even in early stages of cancer also, we started doing this. So only one limitations which I can say specifically is the very advanced cancers and sometimes very hardly closed part of that natural orifice.
Mm-hmm. Okay, so since we were talking about recovery, what is the recovery experience in general for most of the women after V notes?
The recovery will be very quick. As I told
Okay.
you, you'll ask the patient to ambulate to
Mhm.
start walking within 4 to 6 hours after the surgery. We discharge the patients within 24 hours after the surgery. So the recovery will be very fast, and some people will be very sensitive to the pain. So the what I told you previously that there will be some discomfort in your tummy because we have removed an organ. That discomfort, some people will be little bit more. In those
Mhm.
cases, the patients may take recovery for 24 to 48 hours, but most of the people will be fine within 24 hours. They get up, they go to their washroom, they walk. Some people even have seen resuming their work, professional life within 3 days after the surgery. They start doing online or they start doing the work from home initial 3 days, and within 7 days, they start going to their offices and all those things. So the recovery part will be very excellent with VMOS because you don't feel pain. So psychologically also, if you're not seeing any scar on your tummy or no incision on your tummy, you feel very strong. Okay, I did not have any surgery. It's a very small procedure. So let me get up. So most
Mhm.
of the time, the psychology also plays role when you are recovering. So if you feel there is no scar and your skin has not been cut, they feel much more confident about themselves and they start recovering very fastly.
Yes, we've got a lot of information on V notes, especially when it says no scar, no pain, because surgery, whenever we talk about surgery, the pain, the efforts, and everything comes into our mind. But I guess V notes is a good option. But let's rewind our focus a bit. So, are there times when you tell your patients, like, hey, we don't need to go to the surgical route yet. Let's try lifestyle changes first?
Yes. See, as per se, surgery is always the last option because uterus and ovaries are very important for the women to maintain their hormones. See, hormones, especially estrogen, is very important for women well-being. As I told you, your skin, your bones, your heart, everything depends upon your hormones.
Correct.
So, first, always you need to try the mm, treatments which will help you to recover back fastly, right? Where you don't need the surgery. As I told you before, some cases when we give you much medications also, or when you try to change the lifestyle also, they won't respond. In those cases, the surgery will be the very, very last options. First, always you need to try your lifestyle changes whenever you are facing a problem, followed by the medication, then followed by the surgery.
So, Dr. Vindhya, if you can honestly answer me this one, like how much of women's health today could be managed better if we focus more on lifestyle, like our changes in food, movement, and stress?
Yeah, to be honest, 95% we can get rid of all the women health problems if you are especially changing in your lifestyles. Hmm.
Okay.
Because nowadays, what all the newer challenges which we are getting when we are treating the women health is the stress levels. And ideally, most of the women are sitting ideally for long hours because nowadays software professionals and whatever the job you do, it requires a lot of attention to the job and you need to be there for at least 8 to 10 hours. So that itself is a sedentary lifestyle for you. Whenever you are too much sedentary, the chance of you developing the hormonal imbalance and women related, especially reproductive health issues are becoming more. So when you are really want to change your lifestyle, the most of the health issues will go off. Not only reproductive health, even the diabetes, even the hypertension, even your anxiety levels, even your cholesterol levels, all will come down if you try to change your lifestyles.
So, I guess before thinking about the surgery, one should start
Yes.
thinking about their lifestyle. But you
Yes.
said even sitting for long hours, that is also going to get into a
Yeah.
surgery someday.
Yeah, the point is the surgery, as I told you, is the last resort, right?
Yeah.
So whenever you are going to for surgery, try all these things. See, especially when it is related to women surgeries like
Mhm.
uterus removal or ovarian cyst removal or tube removal, except for some emergencies, rest of all the things cannot be the emergency surgeries. So in those cases, first you try yourself. What is your cause? Because when I do the surgery, I can only remove that organ. But already the changes which happened in your body because of your hormonal imbalance and metabolic changes cannot be
Mhm.
reversed back with the surgery. You have to change your things. So first you have to reverse your system. So you start tuning your system, then only the changes will start. See, if it is too much problematic, yes, I will help you with the removal of the uterus or something, but you have to come back to normal. Then the normal life will only come back if you reverse your system and you tune your system to such a way that in a healthy lifestyle, then only it will come back.
True. Okay, so I've seen you talking about 360-degree care. So, which is not just fixing the issue, but it is also helping women take charge of their own health. So,
Yes.
if I may ask you, what does 360-degree care actually look like in real life? Can you share any example with us?
Yeah, actually, I will first explain you what do you mean by 360-degree care approach.
Yeah.
So it generally includes four elements. So it is a natural healing, it with herbal infusions because most of us has developed the oxidative stress because
Mhm.
we eat outside and we have lot of junk foods, fried foods. We don't know how they are prepared. So lot of oxidative stress is there in our body, and we have developed lot of inflammations in our body. So the first thing which we need to concentrate in our body is to remove that oxidative stress and need to remove the inflammation. So this can happen through natural healing. So in that four element, first element is the herbal infusion and anti-inflammatory diets. So we start changing your diets. So some
Okay.
diets are really helpful to reduce your inflammation and which will help you to reduce your oxidative stress. There are a lot of teas like you can say green teas. There are a lot of varieties in green teas like matcha, sencha. All these things have a high antioxidants. So you have to know how much dosage you need to take daily and how many days you need to because anything excess is also problematic. So you have to know exactly what is the things you need to take it. For example, turmeric, which we use daily in our foods, right? We forgot about our older techniques, right? We used to use turmeric in each curry or something wherever we make
Correct.
it. So that has a high dose of anti-inflammatory. So you need to know how much dosage of that should be used and how you need to take it. These are all the things which we used to use prior. Just I'm getting back all those things in your regular life so that that will help you to change it. So one thing, as I told you, first is the natural healing with the diets, anti-inflammatory and antioxidant diet. Second one is the therapeutic workouts. So as I told you previously, that lifestyle changes, sedentary lifestyle is causing you the problem, right? So this sedentary lifestyle, I need to change it. So some people will have endometriosis, some people will have PCOS. So you need to
Mm-hmm.
targetedly give them some exercises which will help you to reduce that problem. So when you come to the PCOS, there are two types of PCOS: obese PCOS, lean PCOS. In obese PCOS, your weight is there. So
Gain.
your waist to hip ratio, your tummy, and all those things are very high. So I have to mainly focus on that area to reduce your resistance in your body. When it comes to the lean PCOS, you don't have any fat. But because of your sedentary lifestyle, your hormonal imbalances, there are insulin resistance will be here. So I need to targetedly give only the exercise which will help you for insulin resistance. So we label it as a therapeutic workouts that addresses your hormonal imbalance. In this
Mm-hmm.
therapeutic workouts, we generally add on to your yoga. For some people,
Okay.
yoga will work out better. For some people, high intensity training will work out better. Some people, small stretching exercises will work out better. So, depending upon your body, you have to choose it. And you need to always remember that daily doing one workout may not help you. You have to change daily one workout so that
Gain.
the resistance in your body decreases and start reducing it. For example, you are obese PCOS. So, obese PCOS will have more of white fat. So white
Mm-hmm.
fat will not reduce that fastly. So it has to be get converted into the brown fat. Then it has to go out of your body. So from white fat to brown fat, there are some exercises, and from brown fat to getting little bit thinner, you have some exercise. So this is a very long process, but it will give you good results and it will be permanent results. So if I give you
Okay.
medications, I can give you only medication to suppress your hormones. I'm not correcting it. You need to
Correct.
understand. So I'm not correcting your body, which is already abnormal. I'm trying to reduce your symptoms.
Mm-hmm.
So if the problem is your health and your body is problematic, so you need to first change the root cause. Then only the change will start to happen. But if you come to me as a doctor, I can only treat you with the hormones, which will help you to reduce your hormonal imbalance, but not the root cause. So
Mm-hmm.
you always focus on the root cause. That is the more important thing. So as I told you, we include the yoga, breathing exercises, pelvic tone exercises. So all these things will be included. See, with all these things also, if you are not able to do the things, then we will shift even the stress reducing things like meditation. This is one more extra, as I told you, four elements. First one is the food, next one is exercise, next one is the psychological support, because lot of the stressful work nowadays causing you hormonal imbalance. So
Right.
psychological support we give you by doing the meditations and training them how to do the meditation. Relaxing exercises and breathing exercises also will help you. The last option is the surgery, which I told you, which I am very expert in doing the vNOTES. So first we will all try all these things. If it is not helping out or it is helping you to some extent and there is a break, even if you're trying it, we will help you with the surgery. And again, we'll ask you to change your lifestyle, which will provide you the permanent solution. So as I told you, this is not just a treatment, but it focus more on to your true wellness for the woman.
Yes. And considering the sedentary lifestyle we are all living
Yes,
in, I guess
yes,
the root cause should be focused more on, and
yes.
surgery will always be the last option.
Last
Probably
option.
no option at all at times.
Yeah. So sometimes you have done all sorts of the things, but still you are facing the issues. Then there is no point in suffering, right? Because your
Yes.
quality of life always get affected. So whenever your quality of life is getting affected, you can choose that. But before choosing that, try all these things which will help you. Because 3 months, if you do whatever we say, that diet control, inflammatory, anti-inflammatory diets, antioxidant diets, yogas, meditation, definitely there will be some change. But if you have to
Correct.
do, you have to do it consistently effort. And if you do one day, if you are not doing the other day, then there will be no benefit of it, because you have to be consistent and persistent in doing all these things.
And one more thing that caught my eye was like you mentioned matcha tea. I guess it is a very trend now. Turmeric, yes, we are all aware that it acts like an anti-inflammatory. But matcha, if you could just give a line or two explanation about that.
Yes, see, I told you green tea, right? Green
Yes.
tea we prefer for antioxidant, not for anti-inflammation. So
Okay.
antioxidant levels are very high in matcha. So there are certain varieties of green teas. As I said, you matcha comes under that, sencha comes under that, bojicha comes under, oolongs comes under this, and you have a lot of tulsi green teas and all those things.
Mm-hmm.
But the highest antioxidant, so we generally measure the antioxidant ECGC, so which says that the level of antioxidants which will help you in your body. So the matcha is trending nowadays, but you have to know exactly how much amount you take it. You can't take it daily also. If you start taking daily, it causes the toxicity in your body. So you should be known, you should be guided with this. You can't take it directly. So you should know how much quantity you need to take and how you need to take it. So generally we mix with the milk, we mix with the sugars and all those things, right? So you
Right.
should be very specific when you want that antioxidant effect should be working properly on you. So every time we start taking, okay, whenever we are feeling weak or whenever we are feeling tired, we start taking this green teas. But that when
Yes.
you take matcha, it should be on empty stomach, which will provide you maximum benefit. So whenever you start to take that natural remedies, you should know when should be taken for it to provide you maximum benefit and how it should be taken and with what combination should be taken and how many days you need to take and when you need to do a break. So all these things are very important when you are going for a natural remedies.
Yes. I guess it is very important for the people who are going to listen to this because matcha is in very trend, and I see a
Yes.
lot of recipes popping up on Instagram daily, sometimes with milk, sometimes with fruit. But I guess in following the trends, we are just forgetting what is the like, why are we doing this? Why are we taking
Yes.
matcha? Not just to follow trends, but it has
Yes.
some properties for our body. And I guess, like you mentioned, that we have to understand first how much we need
Mhm.
it. Because that is very important. Blindly following the trend and taking it every day, consuming it every day is not an option.
Yeah, that's what I'm saying. See, whatever also, see, I told you matcha has a high levels of antioxidant,
Yes.
right? Followed by sencha. So everybody does not require matcha. So,
Correct.
so who needs matcha also should be defined, right? And you should understand what you need it. So going ahead with the trend will not help you. See, I have seen many Instagram because I'm
Yes.
very less on the social media. Patients comes and tell me, Madam, can we try this? Can we try that? I said, see, but every body is a different. Some people start showing the turmeric. Turmeric you use with what do you call? Take it in the empty stomach. It will help you to reduce your weight. See, turmeric you can't take like that. On empty
Correct.
stomach, you cannot take because it has an acidity prone areas. So if you start taking turmeric and acidity, you will increase more. So some people who does not have acidity can take it. So there are certain limitations for everything. Your turmeric also used for both the things for anti-inflammatory and diet, weight reducing. So you need to know when you need to take and how you need to take it. If you are using it to reduce your natural regular anti-inflammatory, you can take on empty stomach, but you have to always understand that turmeric will not get absorbed when you are taking with water. So you have to know it should be taken with fat and you should know how
Okay.
much quantity you need to take it.
Quantity.
See, yes, because turmeric what we get it is a food grade turmeric. Food grade turmeric has a very less quantity of curcumin which will help you for anti-inflammatory properties. And you know, recently have seen many people saying that curcumin is available outside in the label form and all those things. Yes, I have seen those also, but you need to know how you need to take it. Taking daily curcumin one tablet even causes you liver damage. So you have to know how it should be taken. You see, everything, as I told you, in allopathic, we take medications, right? If you ask me
Right.
about the hormonal things, we start give you the hormonal medications. When we give you hormonal medications, they itself has a side effects, right? So even the natural remedies also have side effects. You can't take it like that. You think, okay, natural, whatever, how much I am taking, okay, it is fine for me. It won't work like that because if you're taking it excessive quantities, you need to know when to take it, how much to take it, when you need to stop it, how many days of break you need to give it. All
Right.
those things are very, very important.
Yes. Yes. I guess this is very important, and this was a very important part. Though I did not plan to discuss this, but yes, this was a very important topic to be discussed, that we should not blindly follow the trends, and for every
Yes.
person, there's something unique based on their body.
You have to
So,
understand first your body and you have to
correct,
understand your requirements and what is your problem. Then you need to do and you need to go to a doctor, consult, check your body, what are your problems. Then only you can. See, simply following that is, I have seen many people coming back to me saying, I have followed this, ma'am, nothing is helping out. And if many patients, if I say reduce the weight, they start to go to gym. So there
correct,
is, I told you, right, there are certain therapeutic workouts you need to do according to your problem. You keep on lifting your weights. If you're lean PCOS, if you keep on lifting your weights, how it is going to help you? So always you need to categorize this. So we always prepare a personalized protocol for every patient. We take their history, we take their body measurements, and all those things which are problematic for the patients. And even we check about their sleep cycles, we check about their stress cycles because sleep is most important nowadays. Because of the cell phone addictions, the people start seeing the cell phone during the night time also. They're not getting the sleep. You need to
correct.
understand the
Yes.
cell phone causes you brain awakening. The radiation causes you brain awakening. When it starts brain awakening and your brain acts very actively, then how can you get the sleep? So you need to know that it's a hormone known as melatonin, which will help you to relax your brain during the night times, and you should be very stress free. So we'll take all this history from the patients and we categorize them. So what will help them? And we prepare a personalized protocol about their teas, about their diet, about their exercise, about their yoga, their meditation schedules, all those things. And when it comes to especially for women, there are hormonal changes for every 14 days, right? So first they will get one hormone, after that agreed is another hormone. Depending upon that, also I need to change their workouts. Who are planning for the pregnancy and who are not planning for the pregnancy, all those things I need to see and I need to prepare according to their cycle also.
So, if you're talking about personalized protocols, I'm sure in your career you must have had a story from your practice where surgery plus lifestyle changes really transformed many women's life. But if you could just share one story with us that has stayed with you forever.
Yes, I have a one patient for which I have to do a surgery because it's an emergency ectopic pregnancy where the pregnancy developed into the tube of the ovary. So I need to do it because it's an emergency life threatening. So we have done the surgery for her. We know surgery we have done her. So after that, she want to become pregnant because of her lifestyle, because she is too sedentary, and because of the stress that she's not able to become pregnant whenever she want, and she has lost one tube because of the ectopic pregnancy. She was struggling a lot. I told her, don't get worried, but reduce your things, change your lifestyle. Initially, she tried for 2 to 3 months. She was not able to tolerate because there will be a lot of social pressures also for the women, right? If you're not becoming pregnant after 3, 4 years, the social pressure starts. She also is herself thinks that I'm not becoming pregnant. On top of it, there will be a lot of social pressure. She was struggling. So one of her relatives said that go ahead with the IVF. Why you are struggling like this? So she came back to me. I said, I don't find any problem in you. No, you are perfectly fine. The only thing I could see problem in you is your lifestyle and your stress. If you're not able to manage both the things, even the IVF will not help you. So she listened to me. She did not go for IVF. She was there with me. I made her to do the exercises. We did the meditation. We had given her what are the teas and what diet, personalized diet. She became pregnant. But it took time. It took time. That patience you need it when you want to go naturally, the patience you needed. So she delivered recently only, she delivered normally, and baby boy
Oh,
has been born. So always you need to understand that yes, we have a shortcuts nowadays, but all people think if we are not able to become pregnant on their own, they are talking about the IVF recently. But everybody should understand IVF is not 100%. IVF also has its own set of complications and own set of failure rates. As per WHO organization, all those things, the success rate of IVF is only 40 to 50%. So 50% of chance not to become pregnant, right? So some patients, I can't even avoid IVFs. In those cases, I will always say, you do the lifestyle changes, then go ahead with IVF so that the chance of your success will be more. So always, even the quality of the egg, quality of the sperm is very important when you're planning pregnancy, whether it's a natural pregnancy or IVF pregnancy. So some people, when we remove two tubes, we have to go for IVF, but the egg should be good. In those cases also, I will always suggest that lifestyle changes, change yourself, change your stress levels, then the pregnancy will become very easy journey.
Considering all the lifestyles that we are all living in today, where do you see the future of women's healthcare going? Are we really moving towards this technology plus holistic care, the combination for real, or is that still a dream?
Yeah, previously, if you asked me 2, 3 years back, because of the lot of stress and lack of awareness, the people were only depending upon the technology, on the science to help them to become pregnant, to change their. But nowadays, the awareness started to increase in women. They are also thinking that why I'm becoming like this. So I need to change my body. I need to change my hormones. So because in my lifestyle center, because I have my lifestyle center on my own, which I started after seeing all these things. So I can provide you 360-degree services. If you want the surgery, I can do. Who requires surgery and who does not require surgery, I categorize them and I will tell them these others. So people have started to think in these ways also. So always combining the technology, newer thing with the holistic and older techniques will definitely will help you. And I think in future, women will definitely realize, because already they started to understand the importance of their health. But because of the stress they are facing, they are not able to make it up to that level. But at least they're trying nowadays. So in future, they will realize much importance of their health. When they start realizing, this has a more beneficial, holistic combination of the scientific techniques like vNOTES and all those things will definitely help them. So I think that this has a much role before.
So the last question from my end, I guess this is more for the viewers who are going to watch us and listen to us. So if there's someone listening to us right now, maybe she's scared of surgery or maybe she's ignoring her health because life gets busy. So what is that one thing, Dr. Vindhya, you would tell her today?
So the message I want to give to the women all over the world is first start thinking about your health. Don't ignore it. See, nowadays we have a lot of technology which we help you to not to miss your routine things like your personal life missing or your professional life missing will not be there. So we are there to help you to reduce your stress and we will get back to your work very quickly. So many times you are feeling that because of the fear and anxiety that okay, if I do go to the surgery, who will be taking care of my family and how can I manage my professional life? So with these newer innovations with VNOS, we can give the patients a boon. They can get back to their work very fastly and they can get back to their lives very fastly. And before going ahead with the surgery, the people who are already busy and who are already facing the problems, try to make your health prioritize. At least 1 hour a day for yourself. So if you're not prioritizing your health, nobody will prioritize your health. You should be fine to take care of your family. So if you should be fine means you should prioritize your health very importantly. The health importance will starts with you in your family. If you're taking care of your own health, the kids also learn the things. Okay, I need to take care of my health. I should not eat this. I should not look into the screens this much. I need to do daily exercise. I need to drink this much of water daily. All this starts with you in your family. So don't ignore it. Try to correct yourself. Try to start with little times. Like you start 10 minutes a day walking, next time 20 minutes a day. So first cut down on your outside junk foods, then slowly cut down your fried foods or keep some cheat days. Like that you try to manage slowly and get converted into yourself to a holistic method.
That's a wonderful advice to be taken. So, yes, I guess with this, thank you so much, Dr. Vindhya, for sharing your insights and expertise with us today. It's been truly enlightening to learn about VNOTES and the 360-degree care approach towards women's health. So, to everyone listening, remember that healthcare is not just a treatment, it is more about caring for yourself and that too in a way that fits your lifestyle. So, if you are facing any health concerns, you should always know that there are newer options and supportive approaches available. So, we hope This conversation with Dr. Vindhya Gemaraju inspires you to take charge of your health with confidence and hope. Thank you for being with us today. Until next time, take care and stay well.
Thank you.
Thank you once again, Dr. Vindhya, for a wonderful interview.
Thank you.